this bill ought to be considered just like everything else we're considering. The governor's been careful in how he's looked at this over the last several weeks, and for the reasons that have been pointed out. I mean, we're receiving notices in the Senate that last hearings are going to be March 13th in some cases. If that's the case, we've already had several hours of testimony, but there could be more. Senator Crowe announced last week that he would allow a multitude of other people come and testify to the Health Committee. I think that's a good thing. It's going to take more time to do all that. And once we do that, I assume we're going to have to take some action somewhere at some point. And this bill ought to be considered just like any other piece of legislation that could expand Medicaid, although I'm not aware of another bill out there.
Certainly is the jobs bill as well. It's going to create tens of thousands of jobs over the next few years in Tennessee. So.
As a registered nurse for over 40 years, I have a compelling desire to see an expansion of Medicaid in Tennessee because we have such a high incidence of sick people, poor people, high concentrations of poor people, and we must understand that we cannot make this a partisan issue, that we have to do what is the humane thing to do and expand Medicaid to these 300,000 people, 80,000 of them being children. There is no issue as far as I'm concerned, being a registered nurse, having taken care of citizens for many, many years here in Tennessee.